Pleased to have this opportunity to talk to you and to so many of you. I think many more than we were expecting when we first got invited, so thank you for coming. And really, it's an opportunity for us to hear from you about how you might interpret what we're saying, so it's a really valuable opportunity for us. So we're hoping to really benefit from your learning too. And before I start, I think it's just two things. One, we were commissioned by the Department of Health and Social Care to do this work at the beginning of the first wave, so early summer last year. And I think it's fair to say that what we found the most useful when we were looking at the academic evidence and the questions we asked the people we spoke to around the world was very much framed by what we knew about COVID at that time. So sort of bearing that in mind. But let me start with showing my screen. Can you see that?
No.
No? No. Okay, hang on. I'm used to using Teams, that's the screen. There, see that?
Yeah.
Yeah, good, okay. All good?
Yeah.
Okay, so we were asked what you can learn from disasters around the world, so both internationally and from the UK, that might help with our recovery from COVID. And we split this talk into three sections. One, a general introduction about how we're framing recovery. Two, what we learned about what's needed for successful recovery. And three, we sort of share our reflections about what the health and care system can do, or the role it can play. And I guess it doesn't need saying, but this was for the Department of Health in England. So it'd be interesting to get your reflections on how it might play out in Northern Ireland. We're upfront about the research bias for this work. You'll probably be aware that some countries and some disasters are overrepresented in the literature. So if you think about Hurricane Katrina, for example, very well researched and written up, but might not necessarily be the most fruitful for thinking about COVID. So there's a clear bias. And we were also struck by things that were missing in the literature. And I think the most obvious and most relevant for now is we found hardly anything about how to manage a backlog. So we all know what an emergency response looks like, but what happens when the cameras go away, the cordons come down, the gold command structure stops? Recovery is it's less exciting. There's less guidance about how you do it, but it's no less complex, demanding, and exhausting. And it takes years. It takes years. So think about Katrina and Christchurch. They're 10 years, more than 10 years since their disaster, and they would say they're still recovering as a community. And experience has shown that actually the recovery is often harder to get right than the response phase. This is a well-used graphic to show the emotional responses to recovery. And I think the point is that there's no sort of clear demarcation between when response ends and recovery starts. It's not linear. And I often ask people to reflect about where they think they are, either as an individual or as a country, on this graph. There are lots of different ways to categorize disasters. And we've had some challenge about whether learning from other disasters is actually applicable to COVID, and it's a really fair challenge. And when we started this work, we thought that the most valuable applicable lessons might be from the infectious outbreaks like SARS, but we didn't actually find that. We found that they come from one-off disasters like the Grenfell fire or a train crash in Canada, as well as recurring disasters such as bushfires and floods. And the one group of disasters when we were looking early on that proved less fruitful actually was terrorism. So what did we find was key to successful recovery? It's really worth noting early on that most people have an extraordinary capacity to recover from disasters, but there are marked differences about how people recover and the speed with which different individuals, communities, and systems recover. And that's why it turns out there's lots of interest in trying to work out why that is. And it turns out that individuals and communities that cope better are more resilient before a disaster strikes, which is why it makes sense for recovery to be focused around building resilience. And when you hear talk about resilience, lots of different definitions, but we're talking about the ability to withstand, to cope, to adapt to a disaster and be better prepared for the next one. And you often hear people talk about resilience at 3 levels: individual resilience, community resilience, and system resilience. And the NHS is often focused on system resilience and individual resilience, and we are making a case that actually for recovery you need to pay particular attention and focus to community resilience. And the evidence suggests that building the capacity of communities to be resilient, you're making sure that both individuals and systems are in the best possible health to cope with the impact of a disaster. And we think the focus is right for 4 main reasons. First, that just as in a response, so too in recovery, most people actually get the support from the friends and family around them. They don't get it from statutory services. Individuals cope better when they're connected to communities. They're more resilient when they're connected. Third, it stops people, if you focus on the community level, it stops individuals blaming themselves for feeling like they're lacking resilience or failing. The question like, aren't you over it yet? Makes people feel like they're failing. And then you can't have a resilient system without really understanding what the community needs and having them at the heart of recovery efforts. So that's why we said focus on community resilience. And we were also really struck by some people we interviewed. And remember, this is I guess, sort of towards the end of the first wave, when we spoke to people about their experience of COVID and recovery, and they thought that they hadn't actually been that badly affected by COVID, and it'd be quite easy, relatively easy to get services back up and running. But they reflected that actually, while they might get back up and running, the communities and the individuals, it might take decades for them to recover. So with all that we'd heard and we read, we realised that we're asking the wrong question. So the Department of Health had asked us to basically look at what can you learn about getting the system back up and running as quickly as possible. And we said that's not the right question for recovery. It's what role the health and care system can play in supporting community recovery. And that reframing was absolutely vital to what we did next. So Joni and I are going to talk through the 4 sort of themes that we think are really critical if you want successful recovery. And I'm going to start with psychosocial support. So it's one of our main themes, partly because it affects so many people. So many people experience distress after a disaster, and it has an enduring impact on individuals and those around them. It's also relatively hidden to most policymakers. People can soldier on and never get the right support. And while most people will recover, not everyone will, and it makes a particular group particularly vulnerable. So the first point to make is when we talk about psychosocial support, we're not talking about mental illness. We're talking about a normal reaction to an extraordinary situation. And that's why in the graph, it's important not to pathologize it. One of the things we learned was that when you start talking about psychiatrist or psychological support, it switches people off. They don't think they need it and they don't reach out for that support. So you can see from this triangle that about 3/4 of people will recover and only experience relatively minor emotional well-being issues. Only a small proportion, 3 to 4%, will really go on to develop severe diagnosable psychiatric conditions. And just to state the obvious, because we're not talking about mental illness, most people won't meet the threshold for mental health services. So there's a risk that unless the system reaches out to them, they're going to fall through the net and not get the right support. And what we're talking about is the importance of understanding the impact of living with what we're calling risk and uncertainty. In some of the disasters we looked at, it was often due to people not being able to live in their own home because of floods or fires. But also, if you think about Christchurch, they had one big earthquake, but then they had 1,000 aftershocks during the following year. It's very different in COVID. People didn't lose their homes in that way. But nevertheless, there's a continual stress we saw that we also saw in the literature around SARS, of people living with the fear of bringing back infection to their family and friends and to themselves. And this stress is often bottled up, and it's hard to identify because people start to normalize it. And what you find is people seeing it as normal that they're sleeping less, drinking more, constantly anxious. And it's often sort of underneath the surface. And you get these secondary stressors, which are things that you normally take in your stride, you cope with fine, like job anxiety or issues around family or relationships. But in the context of bottled up stress, they make the situation unmanageable. And one of the interesting things is that economic stresses are particularly important as a secondary stressor. Like it's given our economic situation, I think it's definitely worth bearing that in mind. And when you look at how this situation of stress plays out, one of the things that's really noticeable is that it's not possible to predict who's going to be most affected by it. Even if you think one group is vulnerable, even within a group, you can't generalize about who's affected. So it's not safe to make assumptions, and you really need to get into needs assessment. This slide comes from someone we spoke to who'd worked on the Canterbury earthquake in New Zealand. And you can see the numbers are really significant here. If I think about my local child and adolescent mental health service, how to cope with 350% increase over a sustained time, it's unprecedented. And in New Zealand, they were quite open about the fact that they fell for the myth that families will look after children at a time of disaster, and they will. But when there's so much going on and parents have to deal with so much, the evidence suggests you can't make that assumption safely. And in New Zealand, and also from Hurricane Katrina in New Orleans, we heard that with hindsight, the single most important thing that they would see as the indicator of successful recovery was the children's mental health and emotional well-being. And they learned that the hard way. So just to be clear what we're talking about when we use this phrase, psychosocial support, as a body of evidence that's well established around what's involved. And there are a number of validated tools, and we looked a lot at this one called sense of coherence, which is basically how you make sense of a terrible thing happening in your life. And these frameworks can help with assessing need, they can help predict who might need more intensive support, and it can also help you evaluate different interventions before and after. So there is a body of evidence about what works. Two things in particular come out that we saw about actually practical programs. One's a national campaign, this is All Right from New Zealand, the sort of public mental health first aid programs. They evaluate well, but they're quite general and generic, and you probably tend to need internet or access to a mobile phone to really get the benefit from them. But what was more important was local level interventions. We saw the sort of things that might be familiar to us around social prescribing, bringing people together around an activity, but actually it's the mutual support that is more enduring than the specific activity that brought people together. But they're not mediated by GPs as they are in England. We saw that actually the most powerful ones are the outreach work, they're delivered by community groups. It's bringing people together. And it's that supportive network that seems to be absolutely vital. When we were presenting to the Department of Health, there was something we tried to impress on them, which is when we looked at the literature, it's quite rare for health to actually be a lead body in the recovery. They're often a partner, but they're not usually the lead. And we thought that actually it gives health a particular opportunity to put psychosocial support as a really key factor in recovery, not just acute recovery, but also community recovery. And we didn't think that, in England anyway, many other players would be in a position to do that. We also pointed out that local community groups will struggle to survive, and they will need support to sustain their impact. And then we sort of looked at where there were some really great examples about where people have managed to deliver great psychosocial support. New Zealand was particularly important, as was Latmagantic in Canada, where they had a terrible train crash. And in both cases, the health system put a great effort into studying and writing up what they found out about psychosocial recovery. And closer to home, Grenfell is a standout example, as is the work people have done around mental health support around floods. So I think I'm going to hand over to Joni for the second part.
Thank you. Thanks everyone for having us here. So I'm going to focus on why recovery efforts should make sure that individuals' communities don't get left behind. And there are two main reasons that stood out to us through the research. And one was that we can't achieve community resilience without making sure all aspects of the community are considered. And what we saw was what happened when people get left behind. For example, in the aftermath of Hurricane Katrina, people reflected that they found it really hard to get support for housing, education and health. And this actually decreased their resilience, which opened up unhealed wounds and trauma during further hardships like COVID. Secondly, literature shows that inequalities exacerbate for groups that already experience high levels of inequality, particularly looking through the lens of protected characteristics and socioeconomic status. It's therefore imperative that we focus on all parts of the community that are likely to be left behind. And it's important to note that sometimes these are groups that are not immediately obvious to us. If we can go to the next slide, please, Julia. So what can happen to communities during recovery? Well, there'll be unanticipated groups that are created from a disaster who could be left behind. And we have frameworks such as this one on the slide here that help us to understand the different lenses we might wish to use to identify communities, being that communities of shared culture or geographical communities based on location. And through this, we might be able to anticipate some of the groups that need additional support. However, the impact of a disaster does not fit neatly into the quadrants. And so it's really important not to be too constrained by these kinds of frameworks and to really consider who is being left behind or who could fall through the gaps. And sometimes looking at usual data sets will cause many groups to be missed out. Next slide, please, Julia, sorry. So something that can happen during recovery is that different parts of a community will recover at different speeds when compared to others. And our attention typically goes to the more obvious groups, which are shown here on the left-hand side. For example, we know that people with disabilities are 2 to 4 times more likely to be injured or pass away in a disaster than those who don't. As in the example from Katrina, the death rate increased by 4 times in the African American community in comparison to their white counterparts. Reflecting on COVID in particular, we know that some groups have been disproportionately impacted. For example, ethnic minorities, those impacted by domestic violence, those in care homes, and of course the shielding group. And as we enter the recovery phase, it's really important that we pay attention to the less obvious groups. And this is by no means an exhaustive list, but it offers some examples. So as you heard earlier from Julia, during the Christchurch earthquakes, children, for example, were particularly impacted by the changing family dynamics, seeing their parents with new stresses and that lack of parental input because parents were trying to sort out other things such as housing, for example. And after the train crash in Lac-Mégantic in Canada, we spoke and heard of middle-aged men who are typically high-functioning, who lost their jobs and fall out of the community. And these were people who lacked buffers for when things got really difficult and were not used to claiming aid or help from the state. And finally, we must also consider the healthcare workforce, who we often see as part of an intervention, but they're also part of their own respective communities and are more than just their work. Next slide, please, Julia. So what do communities need from national leaders? Well, they need a commitment from government to reduce inequalities and tackle unmet need as a top priority, rather than just prioritizing the resilience of the system alone. The perception of fairness and good intentions to do the right thing is also important, but it includes positive and deliberative representation at all levels. And lastly, to ensure that there is tailored support, understanding that one size definitely does not fit all. And we have to be really intentional with the types of interventions that are offered to people. Which is next slide, please, Julia. So we did come across some really good examples of where health systems have supported community recovery. And we've got 3 examples here, and just to highlight where positive health system support is typically seen is really through really good engagement and prioritization. And so just one example, after the 9/11 terrorist attacks in New York, despite the delivery of free mental health services, there were still barriers for particular groups in accessing that support. And for example, the African American communities had reduced take-up of post-disaster treatment initially, and so the Project Liberty workforce changed their approach. And by reaching out to specific communities, rather than waiting for them to present. They also hired counsellors from the communities affected by the crisis, who were essential to meeting the needs of hard-to-reach populations, showing their credibility and providing access. I'll stop there and hand back over to Julia, who's going to focus on multi-agency collaborations.
Yeah, I am. And as part of that, the role of genuine deep community engagement in recovery. And there are two reasons why we've picked it out. One is that it helps build community resilience. You know, the more organisations, the broader the perspective you have about what's needed for successful recovery. And the second reason is it fundamentally changes the dynamic of how you work with the community. And we often talk about in our team the image of one table. So it's not one table with people doing the planning and the community on the other, it's everybody around the one table. But what can get in the way? What we found from across the literature and the interviews, and drawing in particular from Christchurch and from Typhoon Haiyan in the Philippines, which was a devastating typhoon, we found three main challenges. One is we're talking about a 10 to 15 year time frame. So if you think about the organisations that need to be round that table, they're going to change over the 10 to 15 years, and being able to bring people in and out successfully is key. And when you've got very different organisations with very different cultures, it's obviously a challenge. If you think about when we looked at Typhoon Haiyan, they had local government, they had the Catholic Church, they had tiny micro community organisations alongside large national, international charities like the Red Cross. And even in that one disaster, if you think about the cultures and decision-making processes of those organisations, they're incredibly different. So how you bring people together effectively is critical. And then it sounds very obvious, but successful collaboration doesn't happen naturally. You need real proactive, deep thought about how to make relationships work during recovery, especially when there's often very intense scrutiny about how recovery is going, and with a workforce that tends to be exhausted post-response. So what did we learn does help? We had 4 broad lessons from the case studies. One is what we're calling managing out the complexity. It's about paying real attention to who needs to be around the table for which decisions. And Christchurch was really interesting. They jokingly referred to their organogram in recovery as the horrendogram, and they paid real attention to governance and decision-making processes, and they actively refreshed who needs to be around the table, and everyone was really clear about how decisions were made and who by. The second is one version of truth. I mean, the whole point of bringing lots of people together is to share that intelligence and make sense of it collaboratively. So we heard examples about, bin men identifying who was most vulnerable and sharing that with the social care workforce. It all helps foster one team and understand the value of partnership working. The third was recognise that the time frame, a 10 to 15 year horizon, put in place things that will help maintain a stable partnership over the long term. It might be multi-year budgets, but it might also be stabilising the bits of the system that might be particularly vulnerable, like the VCSE. And then lastly, it's tactical actions. And it sounds really micro, but it came up repeatedly in the work, is that take opportunities to foster one team. So it's the work together, train together, learn together. So if you're having a workshop on community engagement, everyone goes to it. So the implication is that recovery is not a straightforward technical process where it's clear what you prioritise and what the processes are. We heard very strongly, deep community engagement is required if you're trying to support and understand recovery. And a phrase that I often use is, you can't do it at a distance, you have to get up close and personal. And there are 4 areas that we think seem to help do that. One is give community engagement the priority and legitimacy it needs. Put it on the same level as financial investment and infrastructure. Social capital, that connections you're building, are just so important for recovery. If you say communities engagement, make sure you reduce the barriers for people to get involved. We heard a lot from the States about how they've done that around disability. The third is take proactive action. So, for example, we heard in Grenfell, they didn't wait for people to come to them, they went out and knocked on people's doors. And the conversations they had about what recovery means to people were very different. It wasn't just about service recovery. And then the last one is understanding the importance of connectors. There's lots of different jargon that's used for this, bridges, intermediaries, but it's the people and the organisations that have the credibility and have the voice and understand, all sides of how the system works. They play a really vital role. And then much of what we're saying in this, I think, it goes with the direction of current policy. So the idea of collaboration, integration, health of the population, not just services. But what seemed different for us in recovery is the depth and breadth of collaboration required than the NHS in England, anyway, is traditionally used to working with. Back to Joni.
So I'll just come off mute there. So I'm going to talk about why we should focus recovery efforts on supporting the workforce. And as you've already heard, health and care play a central role in building community resilience. And in turn, this means ensuring that staff in health and care services are given the time and support they need to recover in order to ensure that they can continue to work in health and care services in a supported way that is not further detrimental to their own health and well-being, to avoid large numbers of staff leaving the service, which in turn would increase the stress and strain on the remaining workforce. And finally, to ensure system resilience, which is vital to help support build resilient communities through their everyday contact with the local population. Next slide, please, Julia. So what can happen to a health and care workforce after a disaster? Well, when communities experience a disaster, it's often the health and care workforce who deliver services at the very front line, dealing with a range of complex challenges such as lots of death and traumatic injuries, increased demand pressures with increased patient load, which often doubles up with reduced resources as healthcare workers themselves are affected by the disaster, or their families are, or the concern for their own safety results in a decrease in the available workforce. And in the case of viral infections such as SARS, swine flu, and the Ebola virus, this also included the need for personal protection. And as a result, the health and care workforce are at an increased risk of developing mental health problems such as PTSD, depression, anxiety, compassion fatigue, and burnout. Next slide, please. And there are several examples in the literature and interviews about the impact of disasters on the workforce. For example, immediately following the worst earthquake suffered by Japan in Fukushima in 2011, around half of all healthcare workers did not show up for work. And that number had not fully recovered 18 months post the disaster. And there are complex reasons for absenteeism, such as psychological fear, but also the disruption of supply of commodities such as food, fuel, and means of transport. And there was also quite a specific concern for family safety and well-being, and particularly those with young children. More recent research found that nurses in Fukushima still had greater stress levels than the general population up to 4 years after the disaster. And similarly, with regards to the SARS outbreak, researchers found that staff that had been in contact with SARS patients had higher levels of PTSD and psychological distress. And further studies have found that staff, irrespective of contact with SARS patient, had higher psychological morbidity than the general population. And finally, following the 9/11 attacks, researchers found a marked increase in healthcare responders reporting mental health issues. And studies have found that these levels actually increase over time as a result of attitudinal barriers to seeking mental health support and a desire to handle it on my own. Next slide, please, Julia. But through our research, we found examples of protective factors that can be implemented to help the workforce through to recovery. And this includes ensuring staff are given adequate time off from work to decompress, rest, and reset, but also giving staff access to training and education programs. And this was particularly important for infectious diseases to alleviate concerns and tackle any misinformation. And also finally, about developing a supportive work environment where staff are enabled to deliver their work, be that through staff support networks, access to psychological interventions, but also just taking into consideration the need to access nutritious food and refreshments during all working hours. Next slide, please. So in summary, and as we've heard before, recovery from a disaster is non-linear, and this is no different for the health and care service workforce. We heard in some interviews how staff had already been redeployed to their normal service roles, whilst other staff had continued to work at greater intensity as a result of COVID patients. And this means trying to manage the psychological and emotional support for staff and of communities when they're running on lots of different tracks and at different rates. And finally, we know from the research that psychological trauma of affected staff can persist for many, many decades after a disaster, and is likely to be exacerbated by the likelihood or even threat of future waves of COVID-19. Next slide, please. Julian, I'll pass back over to you.
So we've talked through the 4 themes that we think are particularly critical for successful recovery. And in case that hasn't come through strongly enough, we're talking a 10 to 15 year timeframe. And this has felt sometimes in real contrast to NHS recovery efforts that appear to be very focused on system resilience, recovering services, getting back to business as usual as quickly as possible. But we know for many individuals and communities, recovery is ongoing. It's about learning to live with uncertainty, threat, and risk. And I just want to end with a photo of this community members who survived the Black Saturday bushfires in Victoria in Australia 2009. And this work has brought home how many people around the world live with the constant fear of disasters. So we heard from people in New Orleans that you have a generation that are affected by disaster. You've got children born during Hurricane Katrina. They graduated from high school with COVID, and they spent this summer with the constant effect of new flooding from tropical storms. So it's a reminder that resilience isn't something you fix and you move on. You have to constantly invest in building and supporting those close community connections. And we were told you're never really truly resilient. You can be resilient for one thing one day, and the next time it's something else. And the same can be said for communities too. This work has just really shown us how much there is to learn about how people and systems cope and how you learn to live with risk or living with repeated recovery. Thank you.
Thank you very much, Julia and Joni, for a real tour de force there. Some incredibly thought-provoking insights from a really diverse set of global examples. Very valuable for all of us to be able to access this sort of information, which makes sense of the learning available. And indeed, it helps us avoid getting sucked into the herendogram that you talked about as we seek out good practice from elsewhere in shaping our own recovery locally. So before we open the floor, as I mentioned earlier, I want to go to a number of representatives we have with us today. And if I could go to Shane Devlin first, Chief Executive of the Southern Health and Social Care Trust. And Shane has been really on the front line for the last year and will be critical in shaping the recovery efforts as well. So Shane, your initial reflections, please.
I am, thank you. First of all, Julia and Joni, thank you. I've been busy writing because you have given us so much to think about, and actually one thing that struck me was even the language. We have talked over the last couple of months, because to be perfectly honest, the last year has been fighting the fight. I mean, that's really what we've been trying to do. But the last couple of months we've been talking using language like rebuild and restart, but at no point have I heard recovery. So actually, even the language that we're using in health has not been about recovery, it's been about restart. And that's a fundamentally different word to what you have just described there, which is a path of recovery. So that really, really quite struck me in terms of your thinking. A couple of things that sort of jumped out at me. During the last 12 months, we did 2 listening exercises in the trust. So in and around when you were doing your listening exercise, in and around the end of the first wave, we were also doing a large-scale listening exercise in the trust, and I ran Zoom calls with about 500 members of our staff. And it was really interesting because the diagram you talked about, sort of nearly the heroic stage and the honeymoon stage, we were somewhere over the cusp of heroic into honeymoon. So it was very clear that people were engaged, excited, energized actually by what they had been through. And there was a real single focus. The whole organization had a focus on keeping people well and alive from COVID, and we all came together in a single focus. It was full of energy, and we've got to learn. I think we've got to reflect on that period because it was a positive period. We also then did a similar learning exercise in your diagram, in and around the anniversary stage, okay, in and around that, and we asked a range of staff to reflect on what COVID had been like for them, and we videoed it. So we took, I would say, about 30 staff, and they were nursing, there were care workers, there were porters, there were drivers, a complete range. And we showed those at our public trust board meeting. And actually, for me, what I saw there were three big factors. And if we're talking about recovery, for me, there are three big factors we need to reflect on. And you have reflected on them absolutely in your piece of work. The first one was exhaustion. I mean, it simply was just exhaustion. I can't give any more. So the heroic stage had gone and it was exhaustion. I'm tired. I'm sick and tired of COVID, just sick of it. But actually, the second one was a real feeling of detachment, that they had become detached from their normal social community environment. Our employees were just machines. They were here constantly churning and working, and they'd become detached from that overarching view. And then in a strange way, the final was about self-value. There was this challenge of, what am I about? And it's really fascinating when we're thinking about recovery. For us, it starts to go, we can have this community recovery, and we must have it. And I think your lessons are clear. But each individual person's recovery journey is their individual recovery. And what we're starting to see is people are getting some rest and recuperation, and they're starting to recover a little bit. But actually, it's so much more than that. And it goes down to those workforce factors you talked about the community and about training and about time and space, etc. So I found it fascinating. I have to say, what you are doing in what you've presented to us puts a huge challenge to us. Because there is no doubt, as chief executive of the Southern Trust, I employ 13,500 people and have a budget of £800 million. I'm thinking about organizational recovery in my head. I'm not really, if I'm being honest, at the point where I've really thought of community and social recovery, and I have to get there. There's no doubt about that. But I think health trusts are still in the systems recovery and get services running and things will be good. And you've really put food for thought into my brain, which is actually, as a systems leader, not as a chief executive of a trust, as a systems leader, what is my responsibility? And to the 100 or so people on this call, and we're all part of that system, what is all of our responsibility to rebuild? Because if you're talking a 10 or 15 year period of recovery, and we're talking about annual financial cycles, we're talking about an assembly election some point next year, we're talking about short-term political conversations. How do we change that agenda? And that's the bit that I think we as a community of leaders need to really get our head around. How are we going to change that narrative? Because I think the concept of psychosocial well-being, and absolutely, but do we as senior leaders and are the politicians in that place? So I think you've just given us a huge amount of food for thought. I think community planning can provide a great vehicle for that, and we can really, really think about how we work together. The bit about the parts of our community, and one of the concepts I've started talking about in the trust is the idea that we've dealt with COVID, we now have to work with the consequences of COVID. And they're two different things. So for me, the COVID was a respiratory condition, kind of keep people alive. The consequence of COVID is in our family and childcare world. The consequences of COVID is absolutely our mental health world. It's absolute poverty. They're the consequences. And at the moment, our restart plans are not about that. And we have to get to a different place. So I thank you. I must have written 7 pages of notes when you were talking, because it's actually energized me. but it's also about how do we now get that in the wider psyche? Because the easiest thing for me to do is I can write a plan for the Southern Trust, but that really is not what we need here. So it's a challenge to all of us on this call. How do we do this as a set of systems leaders, rather than rebuild my organization and everyone else rebuilds their organization? So that's my reflection. And you're going to send me home tonight and I won't be able to sleep because my head's going to be gone at this, because I'm going to be thinking, so what are we going to do next? Because actually I think we might have got it wrong just yet, but maybe we just need to be patient. This isn't a fix tomorrow. This is about trying to build a long-term recovery for our community. So thank you, Julia. Thank you, Joni. I found it fascinating.
And thank you, Shane, for that very frank reflection. And we do hope you don't lose any sleep over this tonight. I want to move next to Sharon Russell, who leads the civil service interface with the third sector based in the Department for Communities. And Sharon, it'd be really useful if you could give us a little bit of insight into how your department and your minister is looking at taking forward the transition and the recovery period as we move ahead.
Apologies, I just assumed you were unmuting me. My apologies, I'm unmuted now. Thank you very much, and thank you to our presenters. I had shared your report just even before the scope article with our emergencies leadership group. And maybe if you can indulge me, I'll try. I know that we've been asked to be succinct, but I think just before mentioning what the Minister for Communities very clear thinking is around what recovery will look like for her, maybe just quickly to share some lessons, because we want to take the lessons of the last year and 3 months into recovery. And I suppose the key lesson for us in terms of our work with the third sector was really about how we work. And you mentioned obviously collaboration, you mentioned culture and cultural barriers and all of that. I think we learned some really important lessons this year about how to work with third sector partners and how to engage properly when we couldn't actually engage physically. So it's really ironic that when we couldn't have our boots on the ground, we were closer than we ever were in terms of working with third sector partners at a regional level and at grassroots level. Just before the pandemic happened, we were on an ambition to try to get formal third sector representation in the civil contingencies approach in Northern Ireland. And I had worked up some proposals for that to put to those leading in civil contingency when all of a sudden the pandemic happened. And Minister Hargey brought around the table a number of key partners like Red Cross, NICFA, Volunteer Now, and very, very local grassroots leaders to lead on the response. What we learned from that, I have to say, is that all of the things we've been saying under David's leadership as head of service and with the approach to PFG around relinquishing control, I can safely say, and maybe Seamus won't 100% agree, but I think we did relinquish control. I think as government, it took us a while to realise that we maybe needed to enable through funding, through being more flexible with our funding and our accountability mechanisms and all of that. But we essentially had to enable and get out of the way. So we had communities on the ground delivering before we were. We had them identifying need before we were. When we got through to the last quarter of the year, when we realised that we might need to or want to bolster up the psychological response, health and wellbeing responses from health, and we put in some money there. Again, the sector and the local leaders were able to tell us the way of identifying psychological need was sometimes through the material need, where we were producing, delivering food on the ground and fuel needs. So the link between those things and the learning you've drawn out actually about need that we expected and need in areas and groups that we didn't expect, again, was brought right back into us from the leadership group that we were meeting with. So I suppose those lessons we really genuinely don't want to lose, and the Minister is determined that we will not lose them. Again, you've drawn out what we all knew, I suppose, at the very early stage of the pandemic, existing inequalities would be exacerbated, and indeed they were. So as we move into recovery, we have a very clear focus that for Deirdre, recovery will most definitely be social. We will not be building back better, we will be building back fairer. And that means obviously targeting our resource, and budget constraints obviously are there. In the context of the budget constraints, basic principles that we've talked about, but now we maybe move beyond the talking about them around aligning our community development strategies as we reset our relationship now with the community and voluntary sector. We do need to support them through better funding frameworks, but we also need to align our community development strategies and program lines with what health is planning to do in terms of recovery. And we have supported them through wellbeing interventions in the emergency, and also align those to local government community planning. So the whole community development strategic piece, I think, is a gap for us now, and we need to do that together with the third sector. And as the Minister brings, to her anti-poverty strategy to the Assembly, to the Executive and the Assembly, the key principle of working with the third sector and community wealth building as a principle, I suppose, she would expect us to report that those are fundamental to her approach. And I just have to say, I have found your research particularly useful as we start to bring together those plans, and we will develop our recovery plan with the community and voluntary sector, with NICFA and with our joint forum.
Thank you very much, Sharon, for those comments. And I think the discussion so far has really shown the importance for public sector leaders to be joining with our third sector colleagues to have these discussions today and to take forward more substantive work. So I'm delighted to welcome Seamus McAlevey now to give us his reflections from the very heart of the third sector on where we are now and where we need to be going. Over to you, Seamus.
Okay, thanks, Anne. And I think, like others, saying to Julia and Joni, it's been a fantastic report. When the report was published, our online magazine, Scope, picked it up. Scope editor Nick Garbett critiqued the report and said it was a big challenge for both voluntary and community sector leaders and also the public sector as well. An incredibly important report in that sense, And it certainly chimes very much, I think, with our thinking and picking up on the, the issues, particularly around collaboration during the pandemic. And Sharon has highlighted them there with regard to our minister. I mean, I started talking to the minister in February about the pandemic. Obviously, we had no idea what it was we were looking into. We got an emergency leadership group set up, the minister between government side and the voluntary and community sector, and had the first meeting on the 20th of March, 2020. The following Monday, I think we went into lockdown, and we've been operating in a large part in terms of the organisation in a virtual world thereafter. Our sector responded very quick, I think, as Sharon has said as well. And one of the things that I have highlighted is that we all understand the first responders, but also in our sector, what you've got is spontaneous responders, people who get together and do things and do them quickly to address the problems. So very quickly, community groups in different areas were banded together. They were already trying to help people who were vulnerable. The interesting thing is they actually know who the vulnerable are within their own community, so they could target them very quickly. They could make contact and make sure they weren't isolated. They could make sure they got food, and they delivered food and lots of other things to them. The emergency leadership group then brought a lot of coherence to all of that and brought the government's heft as well. And obviously there was lots done in terms of emergency food and getting that out and working with the councils, working with voluntary and community organisations locally to get those things delivered. What the minister did very quickly as well was say to organisations that her department funded, we're not going to hold you to the targets that are agreed with regard to your funding. We recognise we're in an emergency. And I was saying to the minister, we also need to help these organisations pivot and change what they do. Not just recognized that it might be difficult to deliver some of the things that they've been doing. And that's what the minister did. And very quickly, all these organizations began to respond in the emergency, to the problem of COVID. And I think what we got was great flexibility. On the NICFA Community NI website, within a relatively short period of time, we had over 600 schemes from voluntary and community groups offering support all across Northern Ireland, to people. And flexibility was really important. Collaboration was built very quickly. And what people in our sector who were involved started to say, they recognized we were also building trust between the department and the public sector and our sector at a better rate than we had before. And quite often we will have our differences, we'll argue over things, we will complain about how it takes so long to get approvals, sometimes for things, but things started to go fast and they started to go swift. And we also worked on the premise that we tried things, we refined them. If it didn't work, we didn't do them, and we moved on to something else. So we, as I said, moved fairly quickly. One of the big things that we tried to do at one point was do mass supply of hot food. We couldn't get round to getting that done. It was too difficult. You can imagine what all the people and the fears might have been with regard to the potential for food poisoning and things like that. So we didn't get that done, but we didn't stick with it then. We moved on, and as I said, did other things. The big thing about our sector is, I think, that the organizations actually provided the organizational structures for individual citizens to be able to get involved and respond. And I think that's the important thing, to see our sector as a space, not simply a group of organizations. And what I mean by that is that there were lots of voluntary sports clubs. What do? They normally play football, or they do things like that. But in the time of crisis, they were the ones who were actually delivering the food. They were early organising with the local spar shops in rural areas and delivering supplies to people and doing all of that. Why? Because they had the framework. They know each other as volunteers. And that's a really big asset that we have in the community, and I think have to capture. So there's the structures, there are the networks, there's the infrastructure, and above all, there's actually a lot of community assets, because people think, I don't know, people in voluntary and community organizations are different. They're not. They're people from our sector, private sector, public sector, operating in organizations, and they bring the skills and sometimes the materials and assets they have in their private lives to bear, and that can be tapped into. Coming back to the minister, and as Sharon says, we've been talking about all the issues, and people have been saying this has been really good. How do we maintain it in the future? And the minister asked us in NICFA then to bring forward a paper which we called Manifesto for Change. And we had been talking about these issues to the department prior to the pandemic, talking to others. I had talked to David when he was head of civil service around a lot of these things. We brought it all together, and that paper is available to you. A link was sent out, and we talked about keys that would unlock and create change that would help improve things in the future. And we think we need to improve the understanding between how our sector works and how government side works, and get a better understanding of each other. People tend to take a one-dimensional view, I think, of things. So the bit that they know, that's what they think the rest of it looks like. And that isn't the case. When we looked at key number 2, unblocking key barriers and creating a supportive environment, this is the one around bureaucracy and funding and all of that, which can be the bane of everyone's lives. And I think there's a really good opportunity to do something now, because we have focused this on the programme for government. And the programme for government, first draft, marked a significant change as to how we wanted to do things in Northern Ireland. Why? Because senior civil service, people like David, recognised from the last crisis, the financial crisis, that Northern Ireland, in terms of the financial squeeze, was literally on a burning platform, and our services were going to continue to degrade, and we needed to do something about that. And I think that's where the idea for the changes in the programme for government came about, and the idea of focusing on outcomes being really critical and important. And I think that's where our paper lines up. We want to contribute to the outcomes. And traditionally, or certainly over the last 10 years, the engagement quite often between government side and the voluntary and community sector has been very transactional, individual, around we give you some money and you deliver us something, you deliver something. And we're saying there's something much bigger and larger here, and the pandemic actually flags all of that up. So we need to get a better philosophical understanding of the assets that are available. And one area that I point to, if you take justice, the Department of Justice, it relates to a relatively small number of voluntary and community groups, those that are involved in criminal justice issues. But in terms of the delivery of its overall objectives and safer communities, I think it has to have an interest in the hundreds and thousands of community organizations that can do so much to help improve that safer environment in the places where they live. So there's something really, really important for government to connect to. The other key that we talked about was value in the voice of the community and voluntary sector. I remember one British minister saying a number of years ago, voluntary sector is alive and kicking, and generally kicking me. And what he was recognizing was that actually can be useful, because change is driven within civil society, and it's social movements that drive change in society. Whether you go way back to the abolition of slavery, it was the social movements that eventually made it safe for Wilberforce to change that law in Parliament, and only 5 MPs voted against. It was social movements that led to parliamentary change in terms of votes for women, you know, in the 20th century. And if you think even in more recent times in terms of disability access, 30, 40 years ago, it was really, really poor. And the public attitude might have been, yeah, I sympathize with people, but do we want to spend a lot of money to improve things? I don't know about that. It's the disability organizations changed the mood of people, and eventually it changed what happened in society. So here in that critical comment, I think is important as well. Now, the thing about the pandemic is, I think it's actually proof of concept. And I think that's where we link up with the paper. It is proof of concept that we can do these things and we can do it differently. And from our point of view, we need a whole government response and a whole government understanding, not simply the Department of Communities, because that minister's responsibility. We need for the Northern Ireland Executive to be thinking how it makes best use of what happens in civil society to link with that programme for government and achieve the things that we're really trying to do, because we are absolutely committed to what is written in that document and would like to see that change happen. So I think totally agree with what the King's Fund is saying in the report, that the community-led recovery is key. It is not simply about organisations themselves. And we talk a lot more recently in Northern Ireland of co-production, but still we don't have a clear concept of that. I think it means different things to different people. And co-production really is about involving the beneficiaries as well, the people whose experience can tell the experts how they might improve services. So I think there's an awful lot in the report. I absolutely agree with the others that it's a big challenge for us, and I think we need to be up for that challenge.
Thank you very much, Seamus, for that excellent contribution. I'm going to hand over to my colleague Heather Moorhead now in Nikon, who is going to facilitate our discussion. The floor is open. Heather has indicated who she's going to call on first, but please keep your comments and questions coming on chat, and we'll try to get to as many people as we can before 5:30, when we'll all be dashing off to book the hairdressers.
Absolutely. I see announcements. People will be looking at their Twitter to see what they are. Thanks. This is often a brilliant presentation and some early reactions. And I think the most powerful piece for me just so far is Shane's comment that actually when you shift your focus onto communities and people, you move away from my organisation, my staff, and that allows something else to happen. So I really wanted to focus the conversation on really trying to get us as a set of leaders on what our collective priority should be, and really what processes, because I think, as the ladies rightly point out, we have known a lot of this, but sometimes we're not very good at doing it. So I've been trying to keep a wee eye on the chat, so please keep popping stuff in, because we'll use the chat to write up the notes, and we'll build on this and we'll build it back into our programs. I suspect, Dan, with the amount of attention today, we'll probably be revisiting this topic a bit, I suspect. So we're trying to keep what are our collective priorities and what processes can we use. I'm going to get Helen Moore to come, and then Nikki. Helen, do you want to, you're making some interesting remarks in the comments there. Do you want to say where you're from? Come on to camera and say where you're from.
Okay, hope you can see me okay, Heather and others. I'm Helen Moore, the Assistant Director of Performance and Improvement in the South Eastern Trust, to work alongside Roisin Coulter as the Director of Planning. And I suppose what really resonated with me today was the scale of research that's available to us globally, and the acute reference to recovery. Before we talked about rebuild, and that would have been the phrase that would have been most often used. And recovery, there's opportunities, you've just said there, how can we shift to communities and people, as Shane had referenced. And I think there's an opportunity to work on that through the community planning. Some of the community planning teams, for instance, in Ards and North Down, are starting to reflect upon the plan and the priorities moving forward as we rebuild and recover from COVID. And the other part that I felt was the work that's happening through the strategic outcomes of the new planning model, and how we use that. They have in the document pointed to the NISRA information, the Public Health Agency, and areas of deprivation have significant differences in length of life expectancy or social isolation and loneliness. And it's about directing our efforts as a collective through community planning and through as many agencies, community, voluntary sector, etc., to build and use our resources in a different way and then measure it in a different way. So it's not transactional, as Seamus said there, but actually transformation and how we would actually use that to demonstrate that we're providing a service that's of meaning and helps on that long-term resilience, building resilience in community to recover the society that we all want to live in. And that was really the message I was putting up onto that there's an opportunity there. We have the means, there's the interest in it, and we're being given permission to try to do that.
And Helen, before you move to somebody else, can you say a wee bit about the relationships? Because I think, again, in Julia and Joni's presentation, where the relationships were better, it allowed for that flex. Have you seen changes in those, or changes in power, changes in respect? And can you hang on to those?
Well, definitely, because, for example, the work that happened in the council areas and through community planning to support, as they said, in those urgent moments of need in the early stages of the COVID response, for example, food parcels and supporting families and loneliness, there's a real appetite, because they've got such good feedback, that there's a real appetite to continue to pool those resources and actually build upon that if you listen in on those community planning meetings. So there is an open door and there is a can-do attitude, because Aldrina has put it up on the messages earlier there from the Southern Trust. This is the opportunity to test and then embed change that can really happen, because there's a willingness there to do it together.
And that's very much
barriers. Yeah. Mm-hmm.
So that's brilliant. Helen, Nikki, are you there? I see you. Do you want to come off mute and say where you're from?
Hi everyone, I'm Nicky Conway, Chief Executive with Belfast Central Mission.
Well, you were making some comments about rebuilding and the role of the voluntary community sector, but also sort of reimagining things. Do you want to?
Yeah, I mean, I suppose as a society, we're facing huge issues. We're facing in many ways a perfect storm with the impact of COVID and the recovery layered over the demographic pressures that we're all aware of. Again, then with the downward pressures on public sector resourcing and funding, and the community and voluntary sector, which was already under pressure prior to COVID. So in many ways, that's a perfect storm. And I don't think there's any one sector alone can tackle those issues. So I think the focus really needs to be on collaboration, and there's a real opportunity with the outcomes-based approach for sectors to come together to tackle these issues. I've been really encouraged, I suppose, by the collaboration, as Seamus has already touched on, between the voluntary and statutory sectors in the crisis or respond phase. I think the challenge now is how we move that on to both the recovery phase and then the building back better and what does thriving look like. So it's building on that good work into those new phases.
And Nikki, can I ask, there's quite a lot of talk about building back fairer. I was on a call with Ipsos Mori early today, and they were saying that the public are saying that more money, more NHS staff, waiting lists are their top priorities. How do we get the pressure in the system to build back fairer? Can you see movement in that, or how do we, make sure that that's at the heart? It's really a big message that Julia and Joni were bringing as well.
I suppose that was a bit behind my comment about, I think just aspiring to recover isn't good enough. It needs to be more than just recovering back to the way things were. And what does a thriving society in Northern Ireland look like for us all? There's no one sector or organisation can achieve that. So that's where the collaboration is really, really important in informing that.
Julia or Joni, would you like to comment? Because I think that I hear a lot of people talking about the need to create something new, or the excitement that brings, that it's part of the recovery. Did you find that in the research?
Yeah, it's a phenomenon called post-traumatic growth. Some people experience it, not everybody. It's usually put down to individuals rather than systems. But I mean, I'm struck by the optimism that I'm hearing, actually. I think it feels quite different from the discussions I've been part of in England around. I was struck that one of the messages I often give to England is the health organisations, they see themselves as the system, and the community organisations sit outside the system. And I'm not hearing that from this discussion. You are the system leaders, and you're starting from a stronger position because of that, it feels to me.
Very helpful piece of feedback, Julia.
And then I was just going to say, the thing about building back fairer, I think I don't underestimate the challenges to do that. And I don't know whether Joni touched on some work we came across from Texas, where they call the worst first approach. And so they have changed, they changed their laws around flood protection. So it used to go to areas that were, I guess, often prosperous and richer and whiter. And they changed it to actually to target those areas of the communities that would be harder to recover. And actually it's being very controversial, but it's been implemented. And I think it's a really interesting thing to look at, how you actually bring people with you when you want to change policies like that, when people are going to lose out.
Brilliant, Julia, thanks. Big lessons there. Helen, I was going to bring you in there if you want to say where you're from, Helen. You need off mute. Brilliant.
I'm Helen Honeyman. I'm from Harmony Community Trust, which is a small charity based in Killeith in County Down. My story is very similar to, I think, what Nikki was actually saying, and it really is a plea to move forward and to look at a new, and I don't think it's just collaboration, but a cooperation between the various sectors. As a small charity that crosses various boundaries, we cross the Southeastern Trust and the Southern Trust, we cross the two different areas of the Education Authority, and we work in three different council areas, Newry, Mourne and Down, Ards and North Down principally, but also bordering into Lisbon and Castlereagh. And it is incredibly complex because each of these organizations almost seems to work independently, and it has they have different definitions of what a community is. For example, the local council sees a community has to be a residents association. It's not a community of interest, which came up in the presentation. And I would like to see this COVID pandemic and the whole thing being a chance to move forward and to look at a more breaking down some of the silos that we have in Northern Ireland, instead of going back to what we've been having in the last 20 years, and seeing a much more cross-fertilization. And I would really like, we have definitely benefited from the Department of Community and also from other government agencies who've been more flexible in their funding approach and their support approach, seeing the need to support infrastructure and not just projects and project development. And I would hope that this kind of thinking permeates our thinking for the future as well. And we don't see recovery as going back to what it was post 2020.
Yeah, I think that's important. And I think that you can definitely hear, Helen, in the, whenever I'm around any of these conversations, that something new happens where people come together differently. you know, with the government here and some council there, you don't get change. But when you get that co-creation and building a sense of, I think Julia talked about one truth, you know, that it gives you a basis to move. So I think that's important.
And if I could just add, I mean, some of the emphasis in Northern Ireland is always on, and I'm not in any way disputing the inequalities, but when you put inequalities against geography, it often doesn't pick up the inequalities that actually exist in our society. So, I mean, we are operating in what is perceived as quite a prosperous, peaceful area of Northern Ireland. But within that, and particularly amongst the older generation and amongst families and teenagers and young people, there's considerable anxiety, mental health issues, domestic issues that exist in pockets. So they're not, you know, and they drop through the net. There are people who drop through the net. So I'd like to see, you know, a little bit more understanding of that.
Okay, I just see a comment there from Shane. Could we by accident bounce back to old ways of working? David, David Sterling, do you want to comment on that? Because I think that's everybody's big fear. You know, we've made a massive big movement, and so we've been talking about this. We haven't done it. The COVID has pushed us to do it. We're getting the benefit, but will we go back? Or what can we do to stop us going back, I suppose, is the main.
Yeah, it's funny. I was just thinking about that myself. Firstly, I'd really like to thank Julia and Joni for a really stimulating presentation. I think it's quite clear from the really constructive and very rich discussion that's followed from that there's a real broad consensus that if we want real recovery and renewal, we just can't afford to go back to doing things the way we did before. And I think Shane's right, there is a risk that we could drift back into that. I think Seamus is right. I think the programme for government needs to be the framework for doing things better going forward. And, you know, certainly I've picked up many great ideas today in the discussion, which we can't afford to lose. Some of the highlights for me, just some of the sound bites, if you like. You know, as leaders, we need to commit to reducing inequality. We need to give permission to innovate and to collaborate. Sometimes I think we assume that our people have that permission, but quite often when you ask them, they feel that they need to be given it again. We definitely need to recognise the social sector as an equal partner. And now that I'm working with several charities, I can actually see things from the other side. And there is a lot more that needs to be done at the central government level. And I quite like the notion of central government as an enabler, providing funding and then getting out of the way. But I suppose my key thinking based on today is that we need to make sure we find a way of ensuring that all the good ideas that have been floated today happen. Now, if we just switch off on Zoom here, I suspect we will lose it. And I think actually there's probably an argument for the three organizations, the three hosting organizations, maybe a small number of people from each getting together with representatives from DFC and from the executive office, just to see what practically can we do, what can we put in place to make sure that we actually don't lose the good thinking that we've all heard today, because too often that is what happens. So that would be my thinking, is that we probably do need to follow up on this with some further discussions.
Yeah, I think that's really important, David. And I've just popped into the chat that even my thinking was there. I wonder, there's definite themes of learning. Could we maybe even come up with our own recovery manifesto or charter or vision, based on a lot of that? I'm gonna ask David Babington to come in, because David, you'd made a comment there, you see signs of that, but also wanted to not forget about staff. So Naomi Barr had made a conversation. We've only got about 12 minutes left, so I'm just going to try and get a wee bit of comment in from a few folk. David, do you want to say where you're from?
Thanks, Heather. David Babington here, Chief Executive of Action Mental Health. We're a regional provider of mental health services. I was just really picking up on a few bits of chat there, which Shane started off about, are we slipping back or bouncing back to where we were? I think what Sharon described was the way we all came together was quite remarkable. And if we can really bottle that up and drink deeply of it every day, goodness me, we've been in a much better place. The problem is, I feel we already are slipping back. and certainly our evidence and looking through the list of contracts that we're delivering, already I'm having contracts managers point the finger at our managers saying, why haven't you delivered to the hours or the outcomes you have for this year? And I'm quite flabbergasted, to be honest, that you know, we're having those discussions at this stage. I appreciate we must be held accountable for outcomes, but there was some flexibility in the early parts of the whole pandemic. But already you can see that tightening and that change. I do worry that sometimes at these meetings where we get chief executives and directors, and it's wonderful we're having this talk today, but we all say the right things, but actually does it all filter down? Do all the real, you know, all the contracts managers, the operational managers, they really understand, they get it? I'm not sure. We're missing something there. So I think all the stuff that you've just said there, Heather, about the organizations getting together, but also I think us as leaders, we should be accountable and making sure it goes down through our organizations so the trust, the openness and new culture can really bed itself in.
Brilliant. Yeah, I think that's right, because sometimes I think it's the business processes that shape the behaviours and not the people, but we need to take that on the chin. Naomi Barr had talked a wee bit about staff, and resilience was one of the issues that came up with Naomi around. Naomi, are you there? Maybe you've
Yes, I am indeed.
There you are. There you are.
Hi, can you hear me okay?
Yeah. Continue.
Yeah, so my name is Naomi Dunbar. I'm Assistant Director for Strategic and Capital Development with the South Eastern Trust. And I just felt that we got to the staff issues, but staff have been incredible during the COVID surges. Not only were they dealing with the 3 surges, we've had rebuild and recovery in the midst of it. And now we're trying to roll out the vaccination programme. Those staff during that period have had to worry about their own families and friends and provide support there. And of course, you know, during that time, they might have forgone a lot of their annual leave and time, which I think Helen referred to earlier on, which time to decompress, which is, you know, so important. So we need to provide the support to our staff during recovery. We need to give them time to consider what has happened over the last year and to recover themselves personally. And we need to listen to them and listen to their experience and see what learning we can take from that. Maybe a multidisciplinary subgroup to look at this would be a way forward. You know, we also need to transform the service to ensure that it is sustainable. And we need to value our staff and make sure then that they don't step off this train and they don't go elsewhere and they don't get disillusioned with everything that they've been through. So I suppose that was just my feelings on it. And I mean, I found the presentation today extremely useful, really thought-provoking, really powerful. So thanks very much.
Yeah, I think that's brilliant, Naomi. Thanks so much. I know that Dane Kennedy from DMC is also suggesting about people leaving work. You know, we're going to get a leadership deficit as well at this time. I think we're a wee bit tight for time. I think we could probably go on, and I'll definitely pick up on a lot of what we've got here. We'll commit to do that, whether it's a working group or more conversations or even trying to agree some kind of document. But I just wanted to come back to our contributors because I want to let you go out into the sun at 5:30 just to get some final reflections. So if we could get Julia and Joni, and I'm going to come back to Shane, Sharon and Seamus, and then David is going to close for us. So Julia and Joni.
I've just been hugely impressed by the conversation. It's been a privilege to hear you, and I just think the relationships and the honesty you've got is just, I think, incredible. And I think that the leadership challenge you have is really hard, and I would recommend in one of our references in the bottom of the report, there's a collection of wisdom from 100 leaders who've run recovery, and it's a really great read, and I think you'll find it really helpful.
Brilliant, Julia, thanks. Joni, do you want to?
Yeah, just again to say thank you. Absolutely fascinating to hear the discussion, and quite different to the discussions that we've heard when we've presented more focused when we've done this in England. One thing I would say as well, in terms of the challenge around collaboration. So I you know, one of the things that I remember quite clearly from one of the interviews was about that thought about going back, about, you know, everyone kind of coming together at this time and having those emergency groups kind of really come together and focus and then kind of accountability targets coming back in, and then those being used as a way, and that kind of drowning out some of that collaboration. And I think that's a massive challenge. Alongside the reference that Julia has set out, there are a couple of other King's Fund reports actually that I would point to, that I can send you a link to, where we've worked specifically with systems about that collaboration and how they've really driven collaboration. And this is pre-COVID. So as area specific collaboration between organisations, and how organisations have come together to kind of deal with fortress mentality. So that idea that we're working in organisations rather than as a system alongside with communities, in communities. But just to say thank you again for having us. It was really, really fascinating discussion to listen to.
Thanks, Joni. I think that's important. We need all the support we can to collaborate, even though we know we want to. We're not very good at it. Shane, do you want to just have a few final comments?
Obviously, I'd say thank you to Joni and Julia for stimulating the conversation, but I suppose for me, it's the fact that we have changed dramatically in the last 12 months because we had to. And I think everyone's been on a journey, and we just can't go backwards. And I think that struck me really strongly, that we could accidentally bounce back, is what I put in the chat. So we've got to make sure we don't. I think also that it's a reflection of me. You know, I certainly am being driven down a rebuild model. That's what I'm being driven as a chief executive, down a rebuild model, when actually I need to stop and I need to think about a recovery model. So it's just a thank you. It's put something in my mind, and we have to think about how we can influence, in my sense, influence health to think in that way, so that all departments come together to think in that way. So it's not just about I've got a job to do for health. It's actually how to influence into health, to influence across all, to make sure. I'll try to put in the chat, you know, if different government departments have different recovery frameworks, then every organization is going to be looking at something slightly different. So how do we have one recovery framework for the whole of Northern Ireland? Yeah. And for me, that's just a striking thought that I'm left with. I don't have an answer, I wish I did, but it's just a thought that is now floating around in my head.
No, that's really important. Can I just say, Anne and I will use the conversation that's in the chat. So if you do want to make a comment that you think we haven't certainly been able to get to all of them, because there's real comments and all sorts of things in there. But if you do want to, just put it in and we can make sure that we incorporate it and use it. So Sharon, and then Seamus, and I'll hand back to David then. Sharon, mute.
Apologies. I'm just saying that FM and DFM are doing their press conference, and we're dying to hear about hairdressers. So I'll be quick. And Shane, just to pick up where you left off, David said earlier about, as we know, the executive is looking at its approach to recovery. I mentioned that Deirdre and her party will make sure that recovery is just not economic, it is social. What I would say around a framework for recovery for the third sector is, Seamus mentioned the manifesto for change. The sector set out a challenge to government around how we can work together to make sure that the sector is enabled and it can thrive as at the centre of that recovery agenda. I don't know if you're aware, Shane, but every government department is part of the joint forum that will take that work forward, and we will widen those conversations obviously beyond the members of the joint forum and beyond just government departments and agencies. We're already doing that as we speak. So, you know, I'm pretty confident. I think it's about how we work across boundaries, and that we should be strong enough to challenge and I take David Babington's point, David. I think we need to challenge when you see those things not filtering down. And, you know, we talk about street level bureaucracy, challenge it and come back to us, because as leaders, it's our role to drive that out where we can. So that's mine.
Brilliant, Sharon. Thanks so much. At least it gives us a collective way forward. Seamus.
Yeah, thanks, Heather. There's an old cliche, you know, that says culture eats strategy for breakfast, you know. And I think that's the thing that we have to be mindful of. It is so easy when the crisis passes and the wartime spirit goes to rock back to where you were before. And we all know that. Therefore, that's why I mentioned the programme for government. The ambition that is in there actually deals with a lot of the issues that we've been talking about, the huge inequalities that exist in terms of people's health, and that's been brought out by the pandemic. And it seemed to me that if that ambition was to be achieved, we would have to change the culture of how we did things. And my attitude was I didn't mind where the programme for government started. What I looked forward to seeing would be the pressure that would go on then to change if we were failing to deliver. And I think that's why, you know, I link this back to, you know, to that. And there's a tough road for us to travel on this one, because everybody's for transformation, but nobody, you know, they're all for it in principle and they don't want it in practice in terms of how it impacts our local services. So big challenge for us all. And if we don't do something about it, we'll rock back.
Thanks. David, I'm going to hand back to you to close.
Okay, yeah, well, look, I just agree with everything that's been said in those concluding remarks. And I think the really important thing is we do need a clear single recovery plan. And I think that needs to be very closely linked. Indeed, it may well be a central theme within the next programme for government. But the most important thing is the cultural change that needs to underpin that. And that's essentially the way in which we all work together as public sector leaders, as leaders from across different sectors. So there's been too much good stuff said today to be lost. So I do think there's follow-up work which we need to do together, which we will do. And I think we should see this as an opportunity because it's just too important not to do so. So look, thanks everybody. A really stimulating discussion. And I just wish everybody well, and I hope you all get a haircut quickly. I know I need one.
Brilliant. Thanks everybody. And thanks to our colleagues from London. It's lovely to have you.
Yes, huge thanks, Julia and Julie.
Cheers, guys.
Bye-bye.
Great. Thanks all.
Bye.